A 68-year-old man comes to the emergency department 12 hours after appearance of tender purple discoloration on the thigh and lower abdomen. He began taking medication 4 days ago, remember, after failed cardioversion for atrial fibrillation, but he cannot remember the name. Physical examination shows tender bluish discoloration on anterior abdominal wall. The photograph of right thigh is shown here. You can see which of the following is most likely explanation of this patient's condition. So the patient is having reduced protein C deficiency, So basically this patient was having a tender purple discoloration in his thigh and lower abdomen. So this patient is having some kind of skin necrosis and thrombosis. Sorry, skin necrosis. And you can see there is blue black discoloration, and remember, key point is medication after 4 days ago. If there was HIT or heparin induced thrombosis or thrombocytopenia, it can occur in 5 to 10 days, but this was 4 days ago, so this patient is having warfarin hypercoagulable state. Okay, and this is most commonly due to decrease in protein C level.
Thanks for watching. Please give a thumbs up and subscribe for more.